Hi everyone, my name is Justice Kunedu J, and today I'll be talking about AIDS. Some of this information are new, some are old. Um, these are my previews. What I'll be talking about today: what is AIDS, the national stats, the risks, prevention measures, treatment, and exercise programs that can be used to help people with AIDS or patients with AIDS. First of all, what is AIDS? AIDS is a disease of the immune system due to infection of HIV. HIV destroys CD4 lymphocytes of the immune system, which leaves the body very vulnerable to life-threatening infection and cancers. Um, AIDS stands for acquired immunodeficiency syndrome. It is also the most advanced stage of HIV infection. To be diagnosed with AIDS, a person with HIV must have an AIDS-defining condition and have a CD4 count less than 200 cells. So this right here, this diagram shows how AIDS progresses. How HIV progresses to AIDS. Now over here, you can see the CD4 cells before the HIV infection, and then as you can see the transformation when there is acute HIV infection, you can see the CD4 cells slowly diminishes, and now when there's a chronic HIV infection, you can see it like clearly diminishing now, and then when the AIDS sets in, there was more AIDS cells, there's more HIV cells, and there was just less CD4 cells present. This is a national stats. This stats was taken from CDC. This is very accurate and is the most recent stats they have out there. As you can see, HIV is diagnosed highly among black male-to-male sexual contact, about 10,223, followed by the Hispanic Latino male-to-male sexual contact, which goes up to 7,425. White male-to-male sexual contact, 7,390. Black heterosexual contact, just 4,189. And then black males with heterosexual contact was up to 1,926, and then white women heterosexual contact was 1,032, and then Hispanic Latino women heterosexual contact went up to 1,025, and these is all based on 2016 statistics. This is the latest stats they have out there, and it came from the CDC, which is Center for Disease Control. These are the progression of HIV to AIDS symptoms. If you have HIV and you are not treated, eventually the virus will weaken your body's immune system, and you will progress to AIDS, the late stage of HIV infection. These are some of the symptoms that people experience if you have AIDS. There's a rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck. They also go through diarrhea that lasts for more than a week, sores of the mouth, anus, and genitals. They also experience pneumonia, red, brown, pink, or purplish blotches, all on or under the skin, or inside the mouth, nose, or eyelids. They also experience memory loss, depression, and other neurological disorders. These are some of the causes for HIV or AIDS. HIV is a viral infection that can be transmitted through sexual contact, through blood, or from mother to child during pregnancy, childbirth, or breastfeeding. You can become infected with HIV in several ways, which also includes by having sex. This is a very common way of having HIV. You may become infected if you have vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretion enter your body. The virus can enter your body through mouth sores or small tears that sometimes develop in the rectum or vagina during sexual activity. Also from blood infusion. In some cases, the virus may be transmitted through blood transfusions. American hospitals and blood banks now screen the blood supply for HIV antibodies. So this risk is very minimum. Also by sharing needles or sharp objects. There has been counseled education on sharing sharp objects. HIV can be transmitted through needles, syringes contaminated with infected blood, sharing intravenous drug, paraphernalia, puts you at high risk of HIV and other infectious diseases such as hepatitis. During pregnancy or delivery, through breastfeeding, infected mothers can infect their babies, but by receiving treatment for HIV infection during pregnancy, mothers significantly lower the risk of transferring HIV to their babies. These are some of the risk factors. Anyone of any age, race, sex, or sexual orientation can be infected, but you are at greater risk of HIV/AIDS if you, one, have unprotected sex. Unprotected sex means having sex without having a new latest or a new condom every time. Anal sex is more risky than vaginal sex. That is why the CDC report had the high count for males on male-to-male sexual contact. The risk increases if you have multiple sexual partners as well. Also, if you have another STI, many sexually transmitted infections, STIs, produce open sores or on your genitals. These sores act as doorways for HIV to enter your body. Also, the use of intravenous drugs. People who use intravenous drugs often share needles and syringes. This exposes them to droplets of other people's blood. Also, if you're uncircumcised man, now there's a study that just came out that shows that lack of circumcision increases the risk of heterosexual transmission of HIV. These are some of the treatments and prevention measures that can be used. There is no vaccine to prevent HIV infection and no cure for AIDS, but it is possible to protect yourself and others from infection. One, the use of condom every time you have sex, which is very, very advocated throughout the years. People are advised to use condoms if they are not sure whether if their partner have STIs or STDs. Also consider the drug Truvada. This is the use of combination of emtricitabine and tenofovir. Truvada can reduce the risk of sexually transmitted HIV infection in those who are at high risk. Truvada is also used as an HIV treatment along other medications. Also, toward sexual partners, if you have HIV, it is always important to let your partner know before they engage in any sexual activity. If you have an STI or HIV, also use clean needles. If you use needles to inject drugs, make sure it is sterile and don't share it. Take advantage of needle exchange programs in your community and consider seeking help for your drug use. Also, if you're pregnant, medical care right away is needed, just to protect the baby and reduce the risk of transferring HIV to your unborn baby. Also consider male circumcision. Now, since the study indicates that uncircumcised male have a higher chance of also acquiring HIV, it is then advised for males to be circumcised just to reduce the risk of having HIV. This case that I prepared, this talks about a 55-year-old male, worked as a warehouse associate for 20 years. He's 5'9", 210 pounds with resting blood pressure 130 over 80. Due to the nature of his job, he used to work out 3 days a week, but has not worked out for the past 6 months. His family history reveals that his mother died of myocardial infarction at the age of 70, and his father developed hypertension at the age of 70. He used to smoke approximately a pack of cigarettes a day and drinks beer and vodka daily. A recent blood test showed his cholesterol to be 260 milligrams per deciliter and his HDL to be 40 milligrams per deciliter. He was diagnosed with HIV months ago, which has then progressed to AIDS, and he's experiencing rapid weight loss, extreme tiredness. The client is interested in initiating an exercise program to increase his energy level and put up some weight. So I have the risk stratification here. His family history doesn't count him. He's a smoker, which also put him at risk. His BMI put him above the curve, so he's at risk. He has no hypertension, no dyslipidemia, and the statin 3 also put him at risk. So this is the exercise prescription that I have for this client. The optimal form of exercise training for AIDS patients undergoing treatment. Research studies have generally examined moderate intensity aerobic exercise resistant exercise and combined programs. Now exercise testing, now we have aerobic capacity. We use the boost protocol treadmill test. Having used the run rep max, max heart rate 220, then 55. You go to 65, 165. That's going to be his maximum heart rate. So this is the program that I will recommend for the client. With the cardio, with aerobic training, we have him do 2 to 3 times per week. Have him do 40% or 50 to 65 each hour. Have him do 20 to 30 minutes. Have him use dynamic use of large muscle groups doing cardio aerobic training. When it comes to muscular strength and endurance training, have him do 2 to 3 days per week, 12 to 16 RPE. Make sure he don't get too tired since he's already experiencing tiredness due to the AIDS. Also have 1 set of 3 to 10 repetition, and also 8 to 10 exercises, including all major muscle groups. And also flexibility, we have 2 to 7 days a week, which is very recommended. Let him stretch to tightness at the end, range of motion, but not to pain. Have him do 15 to 30 seconds 4 times. Stretch, and also which includes static stretches, which incorporates all major muscle groups. And these are my references, and